On May 30th, 1995, Nancy Taylor, broker and owner of Prudential Sterling Properties, was driving on Lake Washington Road in Melbourne when a drunk driver hit her car at 90 miles per hour. It took paramedics an hour and a half to extricate Taylor from the wreckage of her vehicle. When her ambulance arrived at Holmes, she had to wait 4 hours for a surgical room because there was no trauma unit at the hospital. Months of recovery under the treatment of Health First physicians and nurses helped Taylor back to normalcy. She vowed to help the hospital raise funds for a trauma center and has since been involved in some way with helping Health First continue to raise the bar in healthcare. Thanks to Taylor and other volunteers and benefactors, today Holmes Regional Medical Center's Level 2 Trauma Center is the only facility of its kind in Brevard and Indian River County. Taylor was elected chairman of the Health First Foundation in January of 2012 and has since helped the foundation raise more than $4 million for vital health needs and services, as well as telemedicine equipment to connect the trauma center with the emergency rooms at Palm Bay, Vieira, and Cape Canaveral hospitals. Additionally, the Health First Foundation has generated funds to provide patient care at the William Childs Hospice House and support services for families and caregivers of the elderly through the Health First Aging Services Center for Family Caregivers. To help nurses improve their skills and training, the foundation raised more than $500,000 for nursing education. Health First Foundation traces its roots to a tradition of community support and philanthropy that dates back to 1937, when the healthcare system's flagship hospital, Holmes Regional Medical Center, opened on land donated by local leaders. In 1995, Holmes and the affiliated Palm Bay Hospital joined with Cape Canaveral to form Health First. In 2004, Health First Foundation incorporated the fundraising volunteer boards of Holmes Medical Center and Cape Canaveral Hospital. Health First Foundation guides the charitable outreach of the healthcare system, which now includes 4 not-for-profit hospitals, a hospice and palliative care program, a physician group, and a comprehensive network of outpatient health and wellness services. As a not-for-profit organization, Health First is a community-owned healthcare system with hospitals that care for everyone who needs services, regardless of their ability to pay. In fact, Health First is the largest provider of charitable healthcare in Brevard, with uncompensated care regularly exceeding $37 million. Philanthropy helps fill the funding gap, taking us from good to great, says Jane McCallum, director for the Health First Foundation. More than 100 volunteers are involved in special fundraising activities that include the Health First Foundation Benefit Ball, the oldest continuously running special fundraising event in Brevard, and the Grape Escape. Brevard's best-known business and community leaders plan and organize the Grape Escape, which typically raises $300,000 to fund new equipment and programs at the Health First Heart Center. The Health First Golf Classic hosts more than 200 community supporters to raise funds for different Health First programs. The foundation also benefits from gifts through wills and memorials and the donation of Health First employees through a payroll giving effort called Eagles. Every associate's gift leaves everlasting spirit. Over the past years, gifts to the foundation averaged $2.5 million annually from 4,000 benefactors. The vital work of the Health First Foundation touches nearly every area of health and wellness services at Health First and helps ensure excellent care is available when our community is at risk. A Central Florida humanitarian organization, the Health First Foundation,